If you have had a laparoscopy and we don't find endometriosis, what happens next? When we do a laparoscopy, we look very carefully for any signs of endometriosis, even subtle. We use multiple different techniques, including palpation. We insert a rectal probe to move organs around. But if we don't find endometriosis, that can be quite confusing. That can sometimes be very upsetting for some of our patients. Now, most of my patients have either been referred with a diagnosis of endometriosis or have already had 1, 2, sometimes multiple operations in other places. So this is not a very common scenario, but I do have patients who come to me for the diagnosis of their pelvic pain, and they're keen to find out what's going on. A lot of their symptoms may be suggestive of endometriosis. So when we do a laparoscopy and find no endometriosis, they could be upset because they had hoped that whilst having endometriosis is not a good thing, but at least they know what's going on, and they were hoping that by removing the endometriosis they will get better. When we don't find endometriosis, that could be a bit confusing. But there are lots of other causes for pelvic pain. If we don't find endometriosis, we'll discuss whether those other causes could be present. But sometimes that would be the end of the road, at least with me, because I don't have any expertise in treating chronic pain. I don't have any expertise in other causes of pelvic pain, including say inflammatory bowel disease or interstitial cystitis that could be a factor.